And welcome back, our viewers, and all the thanks to my colleague Miriam and, of course, to our guest. And for your viewers, as we age, our teeth reflect years of experience and sometimes neglect. Thanks to modern dental technology, even those who have lost most of their teeth, they can now restore their smile through the full mouth implants and prosthetic restorations. But treating elderly patients requires special care, considering bone density, healing, and existing health conditions. Today, we're joined by a dental specialist to talk about the latest achievements in implant and dentistry, the challenges of treating older patients, and how younger generations can protect their oral health for the future. So please welcome with us Dr. Moustafa Moamen, specialist prosthodontist and implantologist. So thank you, Doctor, for being with us today.
Thank you, Abdul Latif, for inviting me today, and welcome to all your audience. And thanks for this interesting topic as well. And I'm here. I'm all yours.
Well, thank you for that, of course. The interesting topic came after you gave us that amazing experience that you have. Being here in Kuwait and helping us, that's actually really remarkable. So I want to ask you about the full mouth dental implants. When it is exactly necessary and when it became a little bit risky?
Very good question. Actually, full mouth dental implants is a comprehensive procedure that replaces all the set of teeth that we have. And it's actually necessary when we lose all the teeth. And this actually, I can say thousands of consequences of having no teeth at all. You can smile, you can talk, you can socialize the way they used to. And many people actually struggle with removable set of teeth, maybe we have seen with our grandparents. And implants come to place to make these teeth fixed, anchored with posts and screws in the bow joints, and help the people to be with the quality of life they used to.
Exactly. But I mean, I think that the teeth is really important, especially that requires a lot of things, you know, to have it. And knowing that the implants is a little bit hard also sometimes, but it became a little bit harder as we know that, especially when it comes these implants procedures for elders. So how is it exactly different for treating the implants for elders, you know, more different than the younger generation?
Honestly, Abdul Latif, I just want to surprise you that many of my patients are in their mid-30s. And of course, when we get older, we are more prone to diseases, we are more prone to lose our teeth, but still we have a big age range that we treat with this treatment option. And age per se is not a limitation. At certain age you cannot have implants. This does not exist. Actually, we can do implants in a plenty of age range. But as we get older, of course, we are more prone to diseases like heart diseases, osteoporosis, diabetes, and many other things.
And these things sets on the way, so it becomes a little bit, let's say, challenges.
Yes, they are challenges, but they are not limitations. Means that if these diseases are under control with other medical doctors, and the patient is taking care of his health or her health, usually this does not forbid that they can have implants in the future.
So how do you evaluate exactly which is every patient, every senior patient is, you know, eligible for the dental implants?
Very good question. Actually, we need to assess the patient in two main aspects. The first one is his general health, and this, of course, with the cooperation of their treating doctors. And the other part is their mouth and the condition of the mouth and the condition of their bone, if they are eligible to have teeth or not, or implants or not. And usually, 99% of the cases, people are eligible to have dental implants because it becomes really easier with time and with technology. Now we can treat more people.
Well, that's actually really remarkable to hear, and it's a little bit comforting. So If I wanted to ask you about the preparations, exactly that it's needed to be done before any before any procedure, what are these medical preparations needed to be exactly?
Yes, there are plenty of them, but with modern technology, we are now searching for something called the virtual patient. What is the virtual patient? That we make a copy, a virtual copy of the patient, involving all his face features, his smile, the 3D model of his teeth or her teeth, the bone in 3D. With all these modern technology, we can really plan the cases very well. And alhamdulillah, we have in Kuwait a lot of access to the technology that is actually state of the art worldwide.
Alhamdulillah. Hearing more about this place, this amazing place that we have in our beloved country, about the latest technology. And we're actually even these weeks, we're actually improving worldwide in every medical and of course in health, you know, procedures, whether it's like became online and, you know, because some of it are now, these procedures been done, you know, from far away, or the 3D imaging and of course the digital planning. So if I wanted to ask you, how have these modern technologies you mentioned, you know, became a little bit, you know, improving the success rate? And not only that, is it like, you know, helping you on the, if there is like any complex or like any hard situation to help you at?
Excellent question. Actually, we used to use the modern technology in the first phase of planning what we are going to do in the future in terms of selecting the proper implants and screws, sizes, angles, and everything, and the teeth, how they will look like in the future. Recently now, we have also in the process of executing the surgery or placing the implants, we have two modern things. We are very glad to have them in Kuwait. Which is, first one, it's something like Google Maps. When you go somewhere, the satellite sees you and directs you where to go exactly with Google Maps. Okay. We have a similar technology in dental implants, that we have a camera that check that the dentist or the specialist is placing the implant exactly as planned. So we bring the planning and the virtual video game stage of the procedure to the actual execution that fits with the planning.
How accurate it is to be done?
It is around 0.2 millimeter accuracy, which is something we couldn't dream of.
Yeah. We can only say it's too accurate.
And the very recent advance that I'm expecting to see in Kuwait in 2026, which is robotic dental implants. This is very modern technology worldwide, and I think Kuwait will be the first one in the Middle East to have the modern technology of robotic arm that places implants inside the patient's mouth. So we are moving very fast in technology.
Well, since you mentioned that, and thank you for that, aren't you afraid that maybe in the future that AI and robotic arm will replace maybe dentists in the future?
The question that we always have. Okay. Not in my lifetime, not on my watch.
We hope not, let's say.
Yeah, but God knows, in the future, the advances are really very fast. We started to have websites that can diagnose the dental problem from the X-ray as fast as a very specialized dentist. So, yeah, God knows.
So, going back to the seniors and to the elders, especially that they are, you know, the backbone of our society, and you know, taking care more of them is really important. So what is the expected recovery process for the elders after having the procedure, like the rehabilitation process, compared, of course, to the young ones?
Usually we don't say that there is like a time frame for elderly and time frame for the younger patient, but we as a rule of thumb, we give a little bit of more time for the healing for the elderly people. As we get older, of course, our cells and biology becomes slower than the way they used to be when we were younger. But in general, we cannot say that those treatments cannot be done for the elderly. It's only for the young generation. We don't have this in
How long it might take for the rehabilitation?
Yeah, this also from the fast development of technology, we started to have the teeth immediately placed on the implants within few days or a week. So the patient comes to the clinic with no teeth at all, and within a week he can function, socialize, do whatever she or he wants with a new set of teeth. These, of course, are temporary teeth that we will replace after a few months, after the complete healing, with new set of teeth. But the restrictions he used to have will be gone in few days. So this is what we actually proud of.
So in a few days, they can function completely with their teeth?
Yes.
That's actually really amazing.
Yeah, beautiful.
And for the amazing job that you have been doing, thank you so much, because you are helping us in many different times. So in the terms of quality of life, as a lot of people know, how much difference do implements make for seniors patients, like struggles with removable dentures?
I want to thank you about this question, because I've seen many people struggling with the removable dentures that we probably see with our grandparents, and they think that there is no other solution. We lost the teeth and this is the only solution we have. No, with dental implants, quality of life can be reversed back to the time that you enjoyed your teeth. You were smiling, you were eating whatever you want, the crunchiest thing that you love, all gone with this removable set of teeth. Now, everything is back. So I just want to give hope. Please, if you have the removable denture, please ask a specialist, and there is a solution. There's a lot of hope. Things changed from the past.
Things are changing, definitely, and thank you so much, Dr. Moustafa Moamen, for being with us at our show in Good Morning Kuwait, having the Good Morning Kuwait with your smiles and helping everyone to have beautiful smiles is really important. So thank you so much for being with us.
Thank you, AziadiQ8, for inviting me.
You're welcome. And for your viewers, it seems that today's episode has taken a medical turn, and we'd like to end right where it's the health truly begins, at the pharmacy. India, often called the pharmacy of the world, has become a global leader in producing affordable and high quality medicines that reach millions of people across the globe. In our final report, our viewers, we take a closer look at how India's pharmaceutical industry grew into a symbol of innovations, reliability, and global health, serving humanity in one medicine at a time. So of course, let's see this amazing report and then we'll be back. So stay tuned.